Get everybody here. We have a quorum. Great. Okay,
In the back, are we ready? Yes.
Great, thank you so much. I'd like to call to order the Committee of the Whole for Tuesday, November 4th, 2025. Roll call, please.
Mayor Kumar,
Here.
Ms. Pichetti, Ms. Elder,
Here.
Mayor Gallo,
Here.
Mr. Love,
Here.
Ms. McPherson,
Here.
Mr. Sleesman,
Here.
Mayor Weiss.
Here.
We have a quorum.
Thank you so much. One question, I didn't see on here, do we need certification of the meeting that was posted publicly? Usually we have that on there, or is it just not, or is that for voting meetings only? You can grab that language, we'll just add that to our agenda.
All right. Mr. President, I advise that notice of this meeting has been posted more than 24 hours in advance and that all usual notification has been given to the media and other interested persons. All requirements of the Ohio Revised Code and rules and bylaws of this board regarding notice of meeting have been complied with.
Thank you so much for that. Next, we have the approval of the minutes for October 7th, 2025. Do I have a motion and a second?
So moved, McPherson.
Second, Sleesman.
All in favor?
Aye.
Opposed? Motion is approved. Item number 3, we have an appointment of some members to the Civilian Oversight Committee. I'm going to turn that over to Doc.
Good morning, Mayor Kumar, members of the Committee of the Whole, and members of the board. I am Flauncey Caver, the Chief Operating Officer here at the Greater Cleveland RTA. Today, I'll be providing a presentation on the reappointment of 2 current Civilian Oversight Committee members. To provide a bit of history, the purpose of the COC is to review and investigate public complaints filed against RTA, transit police employees, and to make recommendations to the Chief of Police. The recommendations that are made must be consistent with GCRTA and transit police rules, policies, procedures, as well as any applicable collective bargaining agreements. When we started this, there were initial 5 members appointed on September 26, 2023, and 2 more members were appointed on June 25, 2024. The COC held its first official meeting on January 30th of 2024. The committee is composed of 7 individuals from diverse communities within Cuyahoga County. At least 1 member of that committee must be a retired police officer with OPATA certification and training, as well as investigative experience. We do have that position filled on this committee. The members are selected by application to the COC by the Board of Trustees, and each member serves a term of 3 years. To provide a bit of perspective, the initial terms were staggered into 1, 2, and 3 year intervals so that everyone wouldn't come off of the board at the same time. We have 2 members who are requesting reappointment. The first is Jonathan England. Jonathan has served in numerous managerial and supervisory roles over the last 17 years. Jonathan has experience and expertise with safety programs, policies, and regulations with a focus on the transportation industry. Jonathan has also served as the 2025 chair of the CLC. His new term will expire 3 years from now in December of 2028. The second member seeking reappointment is Michael Blake. Michael Blake served time as a military police officer for the United States Army and dedicated 35 years of his life serving as a firefighter for the city of Cleveland. During his tenure as a firefighter, Michael worked his way through the ranks from firefighter to lieutenant to captain and finally to battalion chief. Michael Blake is seeking reappointment to a 3-year term that will expire on December 31st, 2028. Staff requests that the Committee of the Whole recommend to the Board of Trustees the reappointment of Jonathan England and Michael Blake as members of the Civilian Oversight Committee. I'm available to answer any questions. I have John Sulik from our legal office here also.
Any questions from the board? Okay. You like a formal motion then to move that forward?
please, to refer to the full board.
Okay, I'd like a motion to refer these two individuals, Jonathan England and Michael Blake, to the reappointed for the terms that were mentioned. Is there a motion and a second?
So moved, Mayor Weiss. Second, Love.
All in favor?
Aye.
Okay, we'll move that to the next meeting. Thank you so much.
Thank you.
No other business. I'll make a motion to adjourn. Is there a second?
Second.
All in favor?
Aye.
Meeting adjourned.
And I will call to order this meeting of the Operational Planning and Infrastructure Committee meeting. Can I have a roll call, please?
Mr. Sleesman,
Here.
Mayor Kumar,
Here.
Mayor Gallo,
Here.
Mr. Love.
Here.
I have quorum.
Okay, our first order of business is approval of the meetings from October 7th, 2025. Do I have any concerns or revisions? Hearing none, I'll move to approve. Do I have a second?
Second, Love.
All those in favor?
Aye.
Aye. Any opposed? The meeting minutes stand approved from October 7th, 2025. We have two items on the agenda today. The first is an IFB procurement, and we'll hear a presentation of a competitive procurement for the second phase of the reconstruction of the grade crossings at Shaker Square and Shaker Junction. And our presenters are, well, not Joe Schaefer, as in the agenda. And then we'll hear from Jonathan Hawley as well. Go ahead.
Thank you, Chair Sleesman. Good morning, members of the committee and members of the board. I'm Kathleen McGurvey, here from the Engineering Department with Jonathan Lawley from Procurement. And we are here again to discuss the reconstruction of Shaker Junction and Shaker Square grade crossings, Phase 2. Here is a little aerial photo showing the project area highlighted in yellow. And this is at Shaker Junction, and the areas in question, the crossings are of the green line over Van Aken Boulevard and the blue line over Shaker Boulevard. The purpose of this project is to replace the existing vehicle crossings at the two locations mentioned, as well as the pedestrian crossings in those two locations. We will also be replacing the existing track structure with 115-pound rail, ties, and ballast. And as part of the track reconstruction, we will be replacing one crossover or switch area that is closest to the roadway so that we don't have to come back in later and close the whole road again. And in addition to the above mentioned, we will be doing an asphalt overlay and pavement markings. And here's a few photos just showing the area. And you can see that it's in need of some attention. And this picture shows the pedestrian crossing over the blue line at Drexmoor Station. And then further into the photo, you can see the blue line crossing over Shaker Boulevard. Here's a view of the green line going west, crossing Van Aken Boulevard. And in the foreground, you can see a portion of that switch area that will be replaced as part of this project. And here's another view of that same area showing both tracks crossing the Van Aken Boulevard, as well as the pedestrian crossing that will be replaced. And now Jonathan will present the procurement portion.
Good morning, Chairman Sleesman, members of the committee, members of the board, Jonathan Lawley, Program Contract Manager. The invitation for bid was issued on September 15th, 2025. 12 parties reviewed the solicitation. 2 firms submitted a bid. The lowest responsive and responsible bidder for this project was Railworks Track Services, LLC. They'll be using Cook Paving and Construction Incorporated and Hatzel and Bueller Incorporated as subcontractors on this project. Railworks Track Services, LLC has successfully completed projects for the RTA, Chicago Transit Authority, Amtrak, Joliet, Bulk and Barge, and CSX, among many others. Staff is requesting this committee recommend award to Railworks Track Services, LLC for this project in an amount not to exceed $2,438,863. Questions?
Questions from the committee or the board?
Hi there, thank you for that. How long will it take to complete the project, and will it, close down any of the crossings for any period of time?
Yeah, it's a few weekends, and unfortunately, I didn't bring the whole thing with me with the time periods. Mike, do you recall the exact time limits?
Yeah, it'll be, we're going to have some shutdown work in the summer of 2026, and that will overlap with that because there's a long lead item on doing the precast panels that'll be under the precast panels that'll be part of the crossing. So the bulk of the work is going to happen next summer. But usually these crossings, we can do them, if it's independent of that, it takes about a 10-day for each. But we have a shutdown scheduled for next summer, and it'll probably overlap with that. So it's the key is getting it awarded now, because it takes 4 or 5 months to get the materials manufactured so that they can go and be installed in a timely manner.
I know this came in under the budget estimate, which is always good to hear. There were 2 bidders. Were we expecting more than that, or is that par for the course for this kind of thing?
Those are the usual bidders. I mean, sometimes we do get a couple others. It just depends on what's on their plate at the time because they're smaller companies.
Okay. I mean, it came in under, so I'm happy either way. All right. So do I have any other questions from the committee and the board? Hearing none, do I have a motion to approve?
I'll move to approve.
Second, Love.
All those in favor?
Aye.
Aye. Any opposed? This will move on to the board, to the full board for approval. Our second agenda item today is the general fund budget, and it's an increase in appropriation to the 2025 budget. We'll have a presentation from Kesa Tula and Eric Vukmanic. The floor is yours.
Morning, Chair Sleesman, members of the committee, and members of the board. My name is Kesa Tula. I'm the Director of the Office of Management and Budget. Today with me is Eric Vukmanic, the Manager of Budgets. George Fields, DGM of HR, Nadine DeJesus, the Benefits Manager, and Kelsey Finnegan from Oswald Companies, which is our benefit consultant. We will be presenting a proposed amendment to the 2025 general fund budget, and I will turn it over to Eric.
Good morning. This is a month-to-month comparison of healthcare and prescription costs in 2024 and 2025. Through October, healthcare and prescription costs were up 34% higher in 2025 versus 2024. If this trend continues in November and December, we are projecting $45.6 million by year end. I'll turn it over to Nadine to talk about stop-loss claims.
Okay, so here you have a look at our high-cost claims for the last couple of years. And we have specific stop-loss insurance that covers claims a claim that is over $500,000. So here, if you look at this chart here on the left-hand side, just to give you an example, for a claim that costs $795,237, RTA pays the first $500,000, and then the stop-loss insurance kicks in and pays $295,237. So we had 3 specific stop-loss claims in 2024, and then we had this year through August 31st, we had 6 stop-loss claims. Next slide. Oh, I have it. Okay, and so this shows you the historical rate increases for GCRTA. So as you can see, the rates have fluctuate over the last years. This is a 6-year average of 3.8%. But if you look at in 2022, we had a rate increase of 10.6%. Before that, in 2021, it was at 7%. So it does fluctuate over the years. And then I'll turn it over to Kelsey for to talk about industry trends.
Hi, good morning, everyone. I'm Kelsey from Oswald Companies. I've worked with RTA for several years now, helping to manage their healthcare costs, run their RFPs, and so certainly am empathetic to the rising costs that RTA is experiencing here. To show you some industry trends, to put it in perspective, we utilize various survey data to help with our projections. One of the common surveys we use is the Siegel Trend Survey, and Siegel projects about 7.9% annual trend for medical, 11.4% for pharmacy. And then recently, Kaiser Family Foundation did publish their projections for the ACA marketplace plans with a 26% increase. So these are certainly, high increases, but when we do look at RTA at a longer time period, that 3.8%, that is performing better than we have seen on a longer horizon. Typically, we see costs going up by about 7% each year. So just wanted to put the more recent numbers into perspective.
For 2025, due to healthcare and prescription costs increasing 34% compared to the 2024 levels, we will need to increase the appropriation to the operating budget by $9 million. And this is just a graph showing that we are increasing our appropriation only to the payroll, taxes, healthcare benefits, and other fringes line, going from $365 million to $374 million. Are there any questions? Any questions from the board or the committee or the board? Mr. Love.
Yeah, thank you for the presentation, and I think we can understand the overall trends in the national context and healthcare costs. I guess I'm just curious, as you're thinking about 2026 and beyond, like, is this something we need to be thinking about from a budget standpoint?
Yes, we've been incorporating this into our 2026 development.
Could you speak a little bit more to that, or?
I was going to say, Kay, do you want to get into the specifics?
So we're currently finalizing the 2026 budget, and we've incorporated a 26% increase in healthcare and prescription costs for 2026.
Hi, thank you for the presentation. Just for my own understanding, what is a stop-loss claim?
So it's a specific stop loss. So one claim that comes in, we are self-insured, so we pay all our claims up front. So a claim that comes in over $500,000, RTA pays the first $500,000, and then the insurance kicks in and pays anything over $500,000 on that one particular claim.
Got it. So stop claim is just the term that's utilized for the amounts that are over the amount that RTA would contribute. Oh, okay. Yep. And then I'm just curious, and we may or may not have touched on this last board meeting, but I'm recalling some conversation. But are we coming up with, as we anticipate healthcare costs increasing over the next year, 2 or so, are we thinking of other ways that may be within our control to ensure that those costs are down?
Yeah, so we are looking at cost containment strategies. Particularly, we have a wellness incentive program, so we're looking at increasing participation into that program due to chronic conditions. This will help drive employees to see their primary care physician as well as a spouse on the plan if covered. It's an incentive that employees receive, so we're working on increasing that participation, as well as other programs, spousal programs, opt-out programs, increasing the dollar amount on those as well. So yes, we are.
Okay, great, thank you.
Yeah, a couple questions. If you go back to the slide that showed the Siegel and the Kaiser, is that 26% for the Kaiser Family Foundation? Is that a combined medical and pharmacy?
Yes, it is. It's for the full cost of medical and pharmacy.
Okay.
Is that kind of the benchmark we're using for budgeting purposes? Is that, I mean, the 26, I assume wasn't a coincidence. Okay. And then just curious, in our plan design, do we have spousal rule where if the spouse has coverage, they're covered under their employers?
We do. I'm going to punt it over to George and Scott, I believe, who's in the corner, only because we were just talking about that, and we also are entering into negotiations as well with different members of representation. So George and Scott, if you want to give high level.
Yeah, thank you, Indy Board Secretary. Mayor Weiss, I didn't hear the entire question, just to make sure I heard the entire question.
I was just wondering whether our current plan coverage for our employees has a spousal provision that requires the spouse not employed by GCRTA, if they are provided cover, then they have coverage under their employer's coverage as opposed to.
Got it. Yeah, so we have a waiver provision currently for folks to be able to opt out and go on to the other health care plan that they're eligible for through their spouse. We're investigating and looking at ways that we might be able to incentivize that more. And there's a couple of different provisions that we're working through to understand how we might do that. In particular, upcoming negotiations will have us look at that very closely.
George, just to follow up, is there an incentive for that spouse, requirement to get off the plan, or is there an incentive for that spouse to move over relative than just waiving the option for health insurance?
So right now, there's just a pure waiver per month. But we're looking at themes that would incentivize the spouse
Just
directly.
to follow up, since we're going through these, is there anything for a tobacco surcharge?
No, there isn't.
Any opt-out incentive?
No, not at this point, but reviewing those items, reviewing those cost containment items for future possibilities.
Thank you.
Mr. Chairman, just for the information of the board members, would you mind reviewing what type of plan designs are offered to the employees? And I'm not asking for detail about co-pays or anything like that, but such as, is there a high deductible plan with the health savings account?
So currently, at the moment, we have two plans through Anthem. One is a PPO plan, which has a larger network, and then we have an HMO plan, which is a smaller. It's Cleveland Clinic based only. So those are the two plans that are offered at the moment.
Are they 80-20 plans? Like what is
90-10.
90-10 both.
Both
Okay.
of them are 90-10.
Okay, thank you.
So that second one is just a narrow network plan?
Correct.
Okay. And then in terms of plan design, I guess, relative to Oswald, what's the nature of your contract with RTA? What type of, is there any consulting there, or are you just going out looking for these different plans to provide the RTA with options? I'm talking, nuts and bolts plan design. Is that anything you're doing? Or is it just going out and providing options for providers?
Yeah, good question. So our contract is structured, it's currently a 4-year deal where we're in year 4, and year 1 is really shopping the market, looking at other providers. So you'll notice there, 2023, we moved from MMO to Anthem, so kind of helping with that process for medical, pharmacy, dental, vision, life insurance, and so it's really RFPs. And then on an annual basis, we do help with renewal planning, bouncing ideas for cost savings. It's more of a limited scope on the renewal basis. However, we are assisting with analysis around high deductible plans, analysis around spousal, things for collective bargaining, things of that nature. Does that answer your question?
Yep.
Okay.
Tony, did you have an additional?
Good morning, Tony Garofoli with Internal Audit. I just wanted to share that we've engaged an audit consultant to audit the healthcare plans, and the scope of that is to review claims accuracy, eligibility compliance, and adherence to the benefit plan rules. We're also going to provide management with some recommendations for improving the plans as we move forward with the new contract.
So one is an audit of the plan to make sure it's in compliance, if I'm understanding correctly?
We're going to be working with our audit consultant, who will be reviewing the healthcare claims from our employees and their dependents.
Get that, that's good.
Looking at how the third-party administrators process those claims in compliance with plan designs.
Yep.
And then looking at the administrative fees that are charged to the GCRTA per the agreement.
Yep, okay. Okay, none of that, that's all good, okay, great. All right.
Yeah, thank you for the overview. I guess just my last question was the stop loss, like, was this an anomaly this year to have this many?
Yes, it is. And so we met with Anthem's medical director and went through these claims, and we were informed that we are having a bad year. And we do look at the claims to see if they will be ongoing or the status, so that we're closely monitoring them.
With the, given healthcare costs are rising, I would imagine there's a higher probability that we'll have more bad years if the amounts on the policy stay the same, since there's inflation in the services and the costs. Are we looking into a need to increase the levels on the stop loss claim insurance?
Yeah, and that's why, what George was talking about as far as those programs that we're looking into, that will help hopefully get some of those spouses or employees off of the plan. But as far as changing the deductible on the stop loss, I guess when we go out for RFP and we look at that information, that's something to look into.
Yeah, I would imagine, given that healthcare costs are rising, also that over the years, that 500,000 and $1 million gets you less. So people will use the same amount of healthcare and have higher bills, and therefore it'll get up to those numbers easily. So I don't know the last time they were adjusted, but whenever I see fixed numbers, given the inflation we've had in the last 5 years, and especially in healthcare, which is even higher, I start to get jittery.
Yeah, based on our size and the stop loss where it's at right now. So Kelsey just said we're about at benchmark with our size.
Okay. Do I have any other questions?
Yeah, I guess Jeff and I were on a call on this, and, I think we can, for the future, take that offline with General Manager, CEO, and George Fields. But I think relative to our plan design and our strategy, we've got to get serious about that. Looking at it right now and trying to be reactive is not what we can do in the future. Mm-hmm. So we've got to take a super hard look at this. We can't sustain this. We can't have, this could happen again next year and the year after with this. If we don't have a strategy in place, a long-term strategy, this is going to really suck our operations dry. So.
Absolutely.
Okay.
Staff requests that the Operational Planning and Infrastructure Committee present the amended 2025 general fund budget to the full board for approval.
All right, for the recommendation, do I have a motion to bring this to the full board?
Motion, Love.
Second, Gallo.
All those in favor? Aye. Any opposed? And I'll go in front of the full board for approval. Those are all of our agenda items for today for this committee. Do I have a motion to adjourn? I will move to adjourn. Do I have a second?
Second, Love.
All those in favor? Aye. Any opposed? This meeting stands adjourned at 9:32.
Thank you. Good morning. Okay, I would like to call to order the Organizational Services and Performance Monitoring Committee meeting. I also would like to apologize for being late this morning. My husband's getting a knee surgery and my kids don't have school, so we're figuring things out. Okay, so we have a couple of things on the agenda. It's just the approval of minutes and then one procurement recommendation. So those of you on the committee and the full board, you have the minutes. Do I have a motion to approve the minutes from September 9th?
Excuse me, we need the roll call. Roll call.
Yeah? Okay. All right, roll call, please.
Ms. Pichetti?
Here?
Ms. Elder? Mr. Love?
Here.
Ms. McPherson? Have a quorum?
Thank you. Okay. So I will once again ask for approval of minutes. If there are no questions or amendments to those from the September 9th, 2025 meeting. I'll motion to approve.
Second, Elder.
Okay. Motion passes. Okay, sorry. Thanks for bearing with me this morning. Okay, so all in favor? Aye. Any opposed? Okay, motion passes. Thank you. Okay, so we'll move on to a presentation by Brian Gibson and Mabry Harris. Am I saying that right? Correct. Okay, for the procurement of tire and wheel maintenance services and leasing of radial tires for a period of 5 years. Please go ahead.
Thank you. Good morning, Chair Pichetti, committee members, and members of the board. My name is Brian Gibson, the Supply Chain Contract Administrator, and I will be presenting the tire and wheel maintenance services and leasing of radial tires. The GC RTA tire requirements encompass approximately 470 coaches, with coaches averaging 50,000 miles per year, 6 tires per coach, 10 tires per articulated coach. The GCRTA operates hundreds of rubber-tired vehicles, providing public transportation throughout Cuyahoga County. To successfully manage this revenue service, GCRTA must contract a tire lease program to allow a qualified tire company to inspect, service, maintain, install, and dispose of tires for all bus fleets. Contracting the tire service to a qualified vendor allows the GCRTA's maintenance staff to focus on bus maintenance and components such as engines, transmissions, and wheelchair assemblies. The tire lease service is critical to the operations of GCRTA. The contractor's responsibilities are ensuring tires are defect-free when receiving, tires are serialized for asset tracking, furnishing all tire materials and labor to maintain the fleet, inspecting each tire's tread depth twice per month, checking and correcting air pressure in each tire at least twice per month, dismounting, mounting, balancing, and rotating tires to maximize tire mileage. Also, the contractor is offering a drive-over tire measurement service called Quick Scan, which will improve service reliability and reduce operating costs. This technology is offered at zero cost to the authority. The Quick Scan reader will provide multiple advantages to the authority. Here are some photos of the technology. The first is a Ballard with a camera to identify each coach. The second is an in-ground reader to measure tread depth and tire pressure on each pass. An additional photo. Here are some of the benefits to the authority. Again, this is zero cost to the fleet. Continuously capturing data as opposed to monthly, irregular wear included in the data and pressure alerts, tread depth and PSI variances. Data can be used to predict other maintenance issues. The data is emailed to the fleet, predictive wear for forecasting on each tire. Quick Scan's data can be used to predict other maintenance issues such as alignment. This would greatly benefit maintenance and safety. Addressing misalignment early will help prevent collisions and curbing while also decreasing service interruptions. This technology was estimated to cost $250,000 per reader, needing 3 for each of our locations, totaling a $750,000 value, coming at zero cost to the authority. Thank you, and I'll turn it over to Mabry.
Good morning, Chair Pachetti, committee members, and members of the board. My name is Mabry Harris, the Fleet Procurement Team Leader for Fleet, and I will be presenting the procurement overview for this project. The RFP was issued on July 27, 2025, and 5 interested parties downloaded the package. 2 vendors proposed. The evaluation criteria used for this procurement were manufacturer's reputation and performance, product design and performance, cost effectiveness, and price. The evaluation panel members were from fleet management, supply chain, office of management and budget, training and employee development, and also procurement. The recommended vendor was Michelin North America Incorporated. Michelin has 50-plus years experience operating tire leases and approximately 23,500 employees. Michelin currently has 34,000 vehicles on contract and sells approximately 250,000 tires annually to transit agencies and motor coach companies. They have experience working with RTA, New Jersey Transit, Port Authority of Allegheny, Massachusetts Bay Transit Authority, and Miami-Dade Transit. Staff's request that the Organizational Service and Performance Monitoring Committee recommend to the Board of Trustees the award of a contract to Michelin North America Incorporated for tire and wheel maintenance services and leasing of radial tires in an amount not to exceed $8,782,484.85 for a 5-year period. Are there any questions?
Thank you so much for the presentation. I'm going to kick us off with one. Could you just share the current state? Like, who do we currently contract with, or do we purchase these services on our own? Just current state.
We are currently with Michelin, and the contract is pretty much the same from previous contract to this contract.
Okay, and thank you. And could you just clarify, you talked about the new technology, which is very cool. Could you clarify how that is working now, or would that be a new service, and how that plays into this proposal?
It's a new offering from the contractor. It was also an offering from other contractors. It's not currently in place. It's something we would like to see in place as, like I stated, many benefits for safety, maintenance. Instead of only having monthly tests of tires, we would conceivably get a reading on every pass of every coach as they came in and out of our properties.
Terrific. And what's the cost differential between the last 5-year agreement and this agreement?
The previous contract was, I don't have the exact number, but around $5.5 million.
And the increase is attributed to what?
So during that previous contract, they had approached us several times for change orders to increase the cost of the contract. Industry standards rising, cost of rubber, just services in general. It was pretty much in line with what we were expecting, and our next closest bid was very close. It wasn't a huge difference between the two.
Excellent, thank you. Okay, any other committee members?
Yes, hi. Trustee Pachetti asked all except for one of my questions. And so just for clarification, you had mentioned something not being of cost to us. Is that the new technology not being of cost to us?
So that bid is just for the contract and services. That technology is being offered to us as a free benefit that we can put into place as soon as this contract is awarded.
Understood. Okay, thank you.
Any other questions? Go ahead.
This question, so these services, do they come on site to Hayden and other locations to perform any of the rotations, things of that nature?
Yes, we do have Michelin employees on site, as well as a site supervisor. And this contract also asked for a part-time float to necessitate vacations, sick time, things like that.
The technology is part, in essence, part of the contract, allows them to do their job for the tire tread and all of that.
It makes their job a lot more predictive and prescriptive. They would get a report on them in the morning that would state these tires are red, and they can address them immediately, as opposed to a longer time, time between reviewing that tire and being able to address the tire.
Interesting. And then, is this just for our buses, or does it extend to other authority vehicles?
Anything that Michelin would outfit a leased tire on. We have buses and paratransit.
I guess I'm looking at vehicles, pickup trucks, things of that nature, smaller scale, that the authority would have, police vehicles.
You just clarified all of our vehicles, so, except for police.
So that does include non-revenue vehicles, including supervisory vehicles and the like.
And is there a reason that police is carved out of that? Out of curiosity?
It's a separate contract. I believe we do that under a separate contract.
Gotcha. Okay, thank you. That's neat.
Yeah, thank you, Chair Pachetti. Just from my understanding, does the Michelin contract currently and this contract cover sort of end of life? So is Michelin responsible for taking the tires off-site, recycling, disposing?
Michelin is responsible for responsible disposal of all tires.
Any other questions from the full board?
None for me, but if it's possible, if you could get the presentation to Brent, I just would have interest in it for another purpose. Thanks.
If I can just request before your committee votes and goes to close, if I can ask administrative support, so Brent and Kay, if you can just double check the committee members on all meeting minutes for the Operational Planning and Infrastructure Committee and also the Organizational Committee. We've had multiple months and some of the players have changed, given changes in responsibility and title. So if we can just make that quick tweak, if there are any adjustments, of course, advise the board. Thanks.
Thank you for that. Okay. Do I have a motion to move this forward to the full board?
So moved, Elder.
And do I have a second?
Second, Love.
Okay, all in favor?
Aye.
And any opposed? Do we have just confirmation, we have a quorum to move this forward? Okay, so motion carries and we'll move this forward to the full board. Thank you very much. Okay, do I need a vote to adjourn? Yeah, do I have a motion to adjourn?
So moved, Elder.
No, I'll go ahead and second that. This committee, all in favor?
Aye.
Aye.
Any opposed? Okay, motion carries. We are adjourned. Thank you very much.
Just, I wanted to wait till we had all our the board members here today, but obviously, over the weekend, we lost one of our longtime board members, Reverend Charles Lucas Jr. He was an appointee of the city of Cleveland, starting with Mayor Frank Jackson, back in February of 2016. He not only served as vice president, but he served as president until March of 24. He was on many RTA committees, but I think we will always remember him as being a fierce advocate for paratransit services and advocating for the best equipment and services for that portion of our constituency. He served with the city of Cleveland of their community relations board. He chaired that, and he has a legacy here with his father, Charles P. Lucas Sr., who was actually the first African-American board member of the then Cleveland Transit System. I know his father was instrumental in casting one of the deciding votes in extending the Red Line out to the airport, making it one of the first major cities in the U.S. to have that service. I know when I came on the board, he was a huge help to me. He always had a steady hand on the rudder. I think he did that for all board members. I know he was a friend of management and cared deeply about the authority. And I'll just turn it over to India for any additional comments.
Thank you. Appreciate that, Mayor Kumar. Good morning, everyone. Again, India Birdsong Terry, General Manager, CEO. I wanted to just share a couple of interesting stories about Reverend Lucas, just on behalf of the team. And then if I could, I think we're in good standing for time this morning. We've got a little bit of time to be able to let a few folks also share their comments. Reverend Lucas has been a part of our family here for quite a while. Starting on the board that predates my tenure here in 2016 for Reverend Lucas, he brought a sense of community to the board. Not only in the idea that he's an advocate for paratransit, but he was an advocate for listening to people, and he was an advocate for talking with people and really providing counsel in a way that is difficult to do when you sit on this dais. He brought a friendliness to the RTA board that really transcended just the responsibility of approving or disapproving a resolution and going through some of the technical capacity items. As a lot of you know, he traveled quite a bit. We did have, for board business, of course, and we did have opportunities for him to do so. He was always, of course, absolutely dapper. We have to keep up with him, and still do. I'm sure he's looking down on all of our outfits and socks and glasses and hats and trying to make sure that we are appropriately, dressed for the occasion. But I think when he did so, he brought a sense of pride with him, right? So it's kind of like the answer of what are you wearing and what are you doing? Your outward impression is just as important as your inward, right? The way that you treat people, the way that you treat yourself is reflective of one another. So if you feel that you've got the confidence and you've got the wherewithal to be in this seat, you deserve to be in the seat that you're in, you have to let folks understand that that confidence is there and it comes from within. He did that every day. He did that whether or not he was able to walk through that door or roll through it in a wheelchair. It never ceased to amaze me the amount of activity that that gentleman had given his physical state. He traveled, and when I mean traveled, went to parades and preached funerals and weddings. Matter of fact, I believe he also married a few of our folks here at RTA, if you weren't aware. The amount of activity and vigor that he had far surpassed any physical ability that he may have outwardly, right? And then also understanding that he understood from both sides of the fence. He wasn't always in a wheelchair. He was at some point towering over 6 feet. So to imagine to have that kind of physical posture and then still be able to impose that kind of will and that kind of confidence from a seated position for what I believe was over 30 years is amazing. And then also to be able to give guidance to a lot of the newer board members, to myself, to a lot of our leadership team. I know Doc traveled with him for several hours in some situations and going to DC in different locations. He very much was an advocate for equality and making sure that inclusivity was included in all of our efforts. So I just want to make sure that we remember him. It is a true celebration of life and his legacy. We will, in actuality, we had conversations. He spoke with a lot of us. I think I spoke with him on Wednesday was the last conversation that we had. And it really was talking about how to close out his time here. He was very excited to be on the precipice of that, to kind of close that chapter. So this was actually to be his second to last meeting. The November 18th was going to be his last meeting as a board member for RTA. But I say that to mean that we have the flower here for him. We'll keep it there until the close of what was supposed to be his last meeting. But also, we had plans to be able to, and which we'll continue to do, have a resolution for him as we do. So we'll bring that to you at the next board meeting. We also will make sure that we're in person at his homegoing services, which I understand are on Monday. And so that is the St. James AME Church, Monday, November 10th at 11 a.m., just as information for you all. I know he'll have a packed house. And then also we are planning and had been planning to erect a plaque for him at Shaker Square. We're in the process of getting that fashioned now. So I did jokingly tell him that would be his Christmas present. So we'll continue to do that, and we'll have to celebrate with his family in lieu of Reverend Lucas himself. But he was beyond excited. So I'm glad to be able to have had that conversation with him so he knew what was coming. So I have no doubt that he'll be there in spirit. I just want to appreciate him. So if we could take a quick moment of silence to be able to remember Reverend Charles P. Lucas, Jr. Thank you so much. And at this time, I do want to take a little bit of moderator privilege and ask anyone on the team that may have, or the board, of course, who may have a quick comment to be able to remember Reverend. I think he would do the same. Doc, I'm going to start with you because I know you got one.
Good morning, Ms. Terry, Mayor Kumar, members of the board, and members of our team. It certainly was a sad day Saturday to hear of the passing of Reverend Lucas. And I'd like to just say a few words about his commitment to our agency, and more importantly, those members of our community who are paratransit riders. As Ms. Terry said, I got the pleasure and honor of being able to transport Reverend Lucas when we went to APTA or other business events that were within car driving distance, New York City, Chicago, DC, Pittsburgh, Columbus, and other places. And Reverend Lucas, being a minister, certainly would minister to you in various ways, a lot of times by the stories that he told. He would frequently say, "Doc, did I tell you that story before?" The answer was yes, but I'd say, "Go on." And there would be a different twist. But I want to share just a story that he tells about really learning about paratransit. When he found out that he would no longer walk, he describes the story that he's riding through the hospital, and he's going to have the surgery when the surgery is going to leave him where he will not be able to walk again. And as he's riding through the hospital, somehow some leaflet falls upon him that talks about paratransit. And in the space of his life where he knew that his life would change, he now had this idea that paratransit would be available. He talks about, coming out of the surgery, finding out that he would no longer be able to walk, and how paratransit provided him a sense of freedom. And if you can envision him riding in his wheelchair, he was certainly free. He could go where he wanted to go. He could engage in the ways that he wanted to engage and continue to have a tremendous effect on our community and those who met him. Frequently, when we had public events, I would be with him or near him. And if you've ever seen the people who run up to him and remember him as a pastor or remember him at funerals, it would just be this amazing feel and a smile that was on his face that I will always remember. I'll share just a piece. Dr. Martin Luther King talks about life in a perspective, and he describes life as being three-dimensional. Frequently, we think of life in only one dimension, and that is length. How long do we live? But Dr. King talks about that our life becomes full in three dimensions, where sometimes people get length, some people get depth, and some people get width. And when we think of Reverend Lucas, we can see those three dimensions, whereas certainly we in ourselves here sometimes are selfish and don't think that there's been enough time and length. We can be comforted in the fact that he certainly had a breadth of life, right? The number of people that he knew, the number of things that he had seen, the people that he has touched, and he certainly had a depth of life. If you've ever, he was a minister, so while you may be talking business, he had this spiritual depth that I always thought was amazing in his ways of understanding people and situations in a layer and being able to relate to individuals with a depth that is generally found in our communities through a spiritual awareness. And those things have always stood out for my vision of what Reverend Lucas is to me, to our organization, and to our community. And so as we mourn his loss, we certainly are comforted by his stories, and those will live on with all of us for a long time. And so I appreciate the opportunity to speak on behalf of it and appreciate our former board member, Reverend Lucas.
Sure. Good morning, Natoya. My relationship with Reverend Lucas goes back the Community Relations Board at the City of Cleveland. It was in my portfolio for the 16 years that I was there under Jackson, and he was the chair of that board. In addition to my work in the church world. So I knew him from a three-dimensional perspective, CRB, the church world, and here at RTA. When I learned that he passed away, the first thing I thought that he is amongst the last of the civil rights titans in Cleveland. And it's unfortunate that so many people forget those who fought for the rights of us that are the beneficiaries of the work that they did. And that work from the civil rights movement still remains today. Education, empowerment, and economics. And that, in fact, is what RTA represented for him in large part because of the accessibility for each of those items that we're still fighting for today. His work at the Community Relations Board was all about relationships in and across the city of Cleveland to make them better. And so, again, as I reflect on him, he is amongst the last of the titans. There are a few of them that are still left, that are in their late 80s and 90s, that we too frequently forget, but we stand on their shoulders, and we shall never forget. That is my favorite line in that movie. You shall never forget. You shall never forget, because of the loss of life, blood, sweat, and tears. We are in places because of their bravery and their courage, and he is one of those in Cleveland.
Well, thank you, everybody. We appreciate taking a few words and moments to remember Reverend Lucas. Unless there is anyone else, I hand it back over to you, Mayor Kumar.
Thank you so much. And Doc, everyone, thank you, Toya, for those kind words. But I think we are adjourned for the day. Thank you so much.
Down, so if you could sign.